I remember a patient who had their wig pulled off when they were at the roller rink, and they became, so acutely stressed, depressed, suicidal.
Welcome back. Thanks for staying with us. We now have Dr. Wendy Sadoff. Thank you for coming.
My pleasure.
And we talked about other topics before, but today we're talking about alopecia. And what is your definition of alopecia? People often see that word and they have no idea what that means. What is your definition?
I would just say it's a general term for hair loss. So really it encompasses a huge number of different reasons and different clinical presentations of hair loss. So it doesn't tell you more or less than just the person has less hair than they did. It could be hair shedding, hair, or patches of hair loss, or scarring, or inflammation, anything.
Okay, perfect.
Covers it all.
So basically your definition is hair loss of any kind. It could be the male type baldness, or even the areata we talked about. So it could be anything, any of those conditions. How commonly do people come to see you in your practice for alopecia?
I see it a fair amount.
Okay.
And again, for many different reasons. A lot of times men are just noticing that their hairline is looking more like their father's or their grandfather's, and they want to know if there's anything that they can do for it. Very common are women who are thinning out and just gradually having less and less hair to work with and cover certain areas of their scalp, and having more visible scalp. And also alopecia areata, very common.
See them earlier, don't you? Probably.
I do, and sometimes it'll be a young man with a little isolated dime-sized hairless patch in the beard area, or it can be more extensive. So encompasses a wide range of severity or areas of involvement. Sure.
And the thing is that lots of people come to you with alopecia in different stages. If you had to say, if I have alopecia, when should I come see you, and when should I just be seen by the general doctor?
I think all alopecia should really go to a dermatologist, and granted I'm biased, but I think that we're really schooled in the evaluation of hair loss and addressing whether it needs a biopsy, whether it needs blood work, whether you can just give reassurance or any further workup. So I think that everything should really come to, unless you just kind of a man is starting to lose hair, his hairline's extending. But even so, we really are very familiar with the medications and the limitations of treatment as well.
Yeah, and so it's an important answer, is that you should see, if you have any questions or doubts about it, at least get an opinion from a dermatologist. They can give you some options and maybe let you know early on, even if it's just simple male type baldness, something simple. It's not very simple when you have it, that what kind of options are out there. Now, Marjorie talked about, at least initially, her condition of areata, so alopecia areata. How often do you see that? Is that very common?
It is very common in the population, 2-3%, and it's, again, can be very limited involvement. Someone may not even be aware that they have it. If it's a very small patch of hair loss, it may be picked up when they're getting a haircut. Someone says, oh wait, you're missing some hair here. So it may not be very debilitating or very noticeable, or it can be much more extensive. And then certainly her case is a more extensive, involvement.
2 to 3%. I mean, if in the United States, that's up to 9 million people, and that's quite a few. And so we need to really, as healthcare providers in general medicine, really be aware and try to recognize what this is, and have those folks go to dermatologists so they can get the treatment they need.
Right. In the beginning, an area of alopecia areata and an area of ringworm of the scalp can look very similar. Yeah. So you certainly want to have the correct diagnosis, because your treatments are very different.
Exactly. And so, it's important for us to get educated. And I think more and more people are getting educated, but it's important to know how many people can really have it. Now, when you have alopecia, it's clearly not, for most people, it's not physically disabling. It's not hurting you, and it doesn't seem to you can live with it, but emotionally can be extremely, extremely troubling. And what do you do that? And I'm sure when you see those folks with alopecia, your job is partly to treat, but also treat the mind. I mean, what do you think about that?
It's extreme. The psychological impact of hair loss in general is extreme, and it's not always related to how much hair loss it is. So someone with very imperceptible hair loss can be much more affected even than someone who has a more severe case. It's not always correlated to the severity of their condition. It's extreme, and especially for children. She recalled just some really emotional times, and that is more common than not. I remember a patient who had their wig pulled off when they were at the roller rink. And they became, so acutely stressed, depressed, suicidal. It's and they have tremendous feelings of isolation. I mean, how many kids are really wearing wigs at that age? And it's isolation, depression. But on a positive note, there are really amazing resources now that maybe they didn't have when she was younger.
The support groups,
right?
Too, right?
The support groups, the National Alopecia Areata Foundation.
They have a great website, yeah.
Amazing. So really good educational resource and support.
Yeah, and so, again, and for parents, and even if you have people in your school or colleagues or friends that have alopecia, whether it's areata or not, it's important to understand how devastating this can be, psychologically, emotionally, and how much we have to support them. It's fun, for kids. They just don't understand what the consequences are. But if you have somebody in your school or in your sphere of friendship or family, it's important to recognize that. And when we come back, we'll talk more with Dr. Sadoff. Please don't go away.
If you can give some educational piece so they can at least be somewhat of an advocate or aware of their condition, that helps some. But some you cannot console and you cannot treat. And if the person is that upset, I think that it's good to work in conjunction with a therapist.
We're back with you again. When we left you, we were talking about alopecia with Dr. Sadoff. And, Dr. Sadoff, when you have alopecia, we talked about some of the emotional aspects, but when you have a patient come in with alopecia, what's your approach in those patients?
First thing is to get a history and find out whether they're just noticing that they have less hair, like they put all their hair in their hands or in a ponytail holder. Is it just slowly becoming less and less, or are they shedding? Do they have an active hair loss process where they're just picking up hairs everywhere? Have they noted bald patches? How's their general health? What else is happening emotionally in their personal life, in their occupational life? And then, of course, to do a complete exam, not only of the scalp, but of the rest of their skin.
To try to get an idea of exactly what's causing it and what pattern. That's
right.
Great. Go ahead, I'm sorry.
So that would be the first thing, to do the proper history and exam. And it's really important because there are even some situations where a person might be severely iron deficient or have a history of iron deficiency, and that could be playing a role.
Sure.
So it's really a more extensive history than you would think for a skin problem.
That's great, and some important points for those of you watching at home is, number one, try to find out what type of hair loss. You talked about, is it coming out in clumps? Is it sudden hair loss? Is it coming out as Marjorie said, in those nice circular areas? And it gives you clues on why it's happening. And once you know why it's happening, as we talked about, alopecia is a general term, which just means hair loss. Once you know the underlying cause, and you can treat it. So, and Marjorie was very eloquent. What did you think of her story? I mean, she's extremely courageous and I just want, what do you think about her story?
Well, the one word would be inspiring.
Yes.
I think her story is amazing. And she gives a pretty typical history of a young patient with extensive alopecia. So again, that psychological trauma, the isolation, the torment, but what an outcome in terms of her strength. So thank goodness.
She comes out so strong. I mean, really, and it was wonderful what she said was, I felt bad for them, that they had to do this to me, which is really unbelievable.
We could figure out a way for people with not only skin conditions, but other conditions where they're affected and different, whatever, that they could understand that and kind of react that way. Yeah, absolutely. So very inspiring. I think she's amazing. And unfortunately, not all kids end up with that strength as adults.
Sure, because they're vulnerable. They're vulnerable at that age, right?
Absolutely.
Yeah.
It affects their ability to socialize, to date, to pick certain occupations. So it can be very devastating.
And I know it can't be stated, with more emphasis, that what she did and how you can extend that to other parts of your life. It's really, I like that word, inspirational, and that you can take that lesson and extend it out and say, this is how I can approach it. Now let me ask you, as a practitioner, as a dermatologist, what's the most difficult challenge in having these patients with alopecia? What's the toughest thing you have to do?
Toughest thing is limitations in terms of treatment options. I mean, it'd be great if once we made the diagnosis, there's, you match it up with the treatment and you've got a excellent prognosis. But unfortunately, many types of hair loss do not have a really great prognosis or even treatment options. So it's more, we try this, we try that, we hope for the best, we offer certain things. Certain things have good prognosis. So let's say someone is having a psychological or a physiological stress and they start shedding their hair. That may have a very good prognosis. Hair grows back. It's just the shock to the system, and it's called telogen effluvium. It's a type of hair loss, and hairs that were just staying in the head, kind of resting, all of a sudden fall out, but very good prognosis. So we tell those patients, just reassure them, and they have a good prognosis. Alopecia areata with coin-shaped small patches, we inject with cortisone, they do great. But male pattern hair loss, some forms of what we call scarring alopecia, where you actually are replacing the follicle with scar, you can't grow a hair there because there's no follicle for it to emanate from. So again, the limitation of treatments.
And we're getting better.
Getting better. It's hard to not offer. We want to make everyone better, and it's really hard to say, we know what you have, but I can't make you better. I think that's the hardest.
You're a good doctor. I think you really care and you feel for your patients. And in that vein, how difficult is it to treat young people or even older people with the emotional part of it? I mean, listen, we have injections, we have treatments, medical treatments, but how difficult is it for you to see these people devastated from something that may or may not get better? I mean, how do you deal with that?
Well, I think it's on an individual basis. Some people can be reassured, and with information and reassurance that, you're not going to go bald or something, even that, because a lot of women think they're going to go completely bald, and you can just say that's not going to happen, and you can reassure them and give them some education. I think, if you can give some educational piece so they can at least be somewhat of an advocate or aware of their condition, that helps some. But some you cannot console and you cannot treat.
Right.
And if the person is that upset, I think that it's good to work in conjunction with a therapist, because there's that mind-body connection, and the stress over the hair loss is only going to make that condition worse. So.
Absolutely, and you said it very well, and I firmly believe in this mind-body connection, in the sense that you can't just treat the body alone. You've got to treat the mind, especially in conditions like this. And and for us who are healthcare practitioners, healthcare providers, you can't always do it alone, and you have to have partners and good partners. So whoever, if you're watching, always get a good partner that can treat these folks. Great advice. I appreciate it. We have to take a break. When we come back, we'll take some questions from our studio audience. Please don't go away.
Many treatments, but oftentimes when you find a condition that has many treatments, not all of them can work really well. The standard treatment, injection with cortisone, actually does work well. And also sometimes the body on its own, without any treatment, that hair will fill in.
Thank you for coming back. We now have some questions from our studio audience we're going to answer. Are you ready, Dr. Sadoff?
I am.
Perfect. This next question.
Hi. I was just wondering if alopecia areata can be reversed.
Well, it's a great question. So what happens is if you have the hair loss, and usually it's in smooth areas, smooth clumps, and when that hair is lost, can that be reversed?
Absolutely. There are many treatments, but oftentimes when you find a condition that has many treatments, not all of them can work really well. The standard treatment, injection with cortisone, actually does work well. And also sometimes the body on its own, without any treatment, that hair will fill in. So when you say the condition is not cured, it's not reversed,
you control
but can individual patches regrow hair? Absolutely. And the earlier you treat and the more minimal the disease there is at the time of treatment, the better the outcome is.
And so the answer is the hair follicle is still has the potential of regrowing hair. It's not that there's scar tissue and permanent damage. And that's something that people think because it's smooth and it's not the same kind of the hair loss pattern that lots of us are aware of, we think that, you know, this is not going to come back. And what happens when it becomes more extensive? Is that a different story? Do you get, is it possible to regrow hair then?
It's possible, much less likely. The more hair that is lost, the less optimistic we are about regrowing hair.
Yeah, so the idea is, again, like every other disease we treat, try to get treatment early, see your dermatologist. And often, you know, we're seeing our family doctor, but you may have to do more. You have to see a dermatologist. Are there general doctors that can treat areata? I mean, do you think that all patients with alopecia areata have to see a dermatologist?
I'm biased. I
Sure.
would say yes. I also think that the critical reason to see a dermatologist is to make the diagnosis. There are mimickers of alopecia areata, and you have to find out exactly what type of alopecia it is. Is this an alopecia where there is still a viable hair follicle that can grow hair? Or is there hair follicle death replaced by scar? Is there inflammation? Is there a better treatment for it? Is a biopsy necessary? And I
Lots
think
of
that
questions.
there are, and I think that a dermatologist should be the one to evaluate, because when we do those biopsies, we take a biopsy in a certain way, in a certain place in that hairless patch, and we process it in a very specific way and send it to a very specific skin pathologist. So all those connections, so that we can get the most information back.
When do you do a biopsy? I mean, just because we don't do biopsies on everybody, when is a biopsy necessary for this condition?
I think when there is any diagnostic dilemma. I mean, there are cases that are very clear. Most of the time, it's pretty clear that it's an alopecia areata patient, but there are times that the diagnosis is less clear, and it will give you not only information to give the patient in terms of their diagnosis, but their prognosis, and give you an idea in terms of some treatment options that you might have.
Perfect, great advice. Thank you. Next question. Yes, sir.
Hi, for male pattern baldness, how effective is surgical therapy?
You know what, surgical therapy can be extremely effective, you know, if done in the proper way, in the right hands. And that's the key, isn't it, Dr. Sadoff, is that to find the right surgeon and to find the right person that deals with your hair loss so that we can get the adequate effects. What do you think about that?
We have to find the right surgeon, and you have to have the right patient. There's an appropriate patient. Not every man with male pattern hair loss is a candidate for hair transplants, but a good candidate and a great doctor, I mean, you can have a really nice result.
Who's a good candidate?
Well, you know, where there's some forehead recession
Yeah.
is a great candidate, but if you're going to end up with kind of that friar tuck fringe and you are going to end up with then you're not a good candidate, because you're going to end up putting some hair transplants in the front and then losing so much around those transplants. But if you are just kind of that where your forehead's getting a little higher, there are some great techniques using small numbers of hairs. So the results over time have gotten better and better also.
And how do you go about it? Like, how people at home are watching saying, you know what, how do I find the right hair transplant? You see all these advertisements on TV. They all claim they're just the best ever, you know, surgeon or technique. How do you find that?
It's a really good question. I think it's like finding any other specialist, a plastic surgeon or whatever.
I'm sorry, could you hold your thought 1 second? We have to take a break. When we come back, more with Dr. Sadoff. Please don't go away. What's out there that's over the counter that actually can work? Because there's claims all over that it can go. What do you think can work?
The only thing Rogaine is over the counter,
Sure.
and there is evidence that Rogaine can work. It's not going to work in everyone, but the risk to using it is very slight.
Welcome back. Thanks for staying with us. When we left you, we were answering some questions about alopecia, and we left off that you talked to us about finding the right hair transplant surgeon. Can you tell us a little bit more? I'm sorry I interrupted you.
It's okay. I think it's like finding any specialist. You need to ask a lot of questions. You need to have multiple opinions before you go doing anything surgically for your for the male pattern baldness. So there are great people around. It's just get different opinions, get references. We're a good place in terms of a dermatologist can direct you to.
And if you have some questions, it's difficult. You know, in my mind, when you go to the web or you try to get information, it's hard to know where this originates from when you go to some website. I think the best spot to me would be go to your dermatologist that you trust and have your dermatologist say, this is the person I would go to and this is the reason why.
Right.
So
we also could maybe say, no, you're not going to be a candidate, and kind of save someone some time, maybe offer them other lots of money, and offer maybe other options, Rogaine, Propecia, things like that.
Perfect. Thank you. Next question. Yes, sir.
Does shampoo affect male pattern baldness?
There's a lot of information that people have about that, and it may help. What do you think about that? Can it help with or even affect it in any way, male pattern baldness?
Well, people are worried that some shampoos will cause hair loss and others may help with hair loss, and they're really not that powerful to do either. So whatever shampoo you like to get your hair clean and your scalp feel good, it's fine. It doesn't cause, no, there's nothing, it's all inside, it's under the surface, so shampoos aren't going to make a difference, and hats, nothing else.
Put those hats back on, that's right. No worries, right?
Right, right.
Next
Wear your
question,
hat.
yes.
Hi.
Hi.
Is early treatment for typical baldness effective?
You know, it's a good question. What do you think? I mean, early treatment for any disease we think is usually better than late.
Right.
What do you think about this problem?
Well, it depends on what the cause of the baldness is. If it's a woman who is thinning out, yes, there's some limited treatments. It's always better to catch something early. And so alopecia areata, yes, if you've just got a few patches, easier to treat. Male pattern hair loss, the results are going to be better with some of the topical or the Propecia, treatments. So yes, early treatment it really is key.
And for male pattern baldness, are there any for those of you who are watching, saying, what can we do? That's very common. What can we do? And what's out there that's over the counter that actually can work? Because there's claims all over that it can go. What do you think can work?
The only thing Rogaine is over the counter, and there is evidence that Rogaine can work. It's not going to work in everyone, but the risk to using it is very slight, other than maybe some irritation. So I advise Rogaine. I think try it, maybe a 6-month trial of it, see if it helps you. Other things over the counter, I mean, we sometimes recommend biotin. So again, there is some evidence that biotin can help with hair growth and, again, safe to use. So no reason not to try that either.
And again, another reason to see your dermatologist, because you can get all this wealth of information and not have to guess. So perfect advice. Next question, yes.
Hi.
Hi.
Is alopecia areata hereditary?
It's an autoimmune condition, so people think that, there may be some hereditary or genetic components. What do you think?
Definitely, we see families where they have that. But again, like I mentioned earlier, it may be that one member of the family has an autoimmune thyroid disease, another has alopecia areata. And it's not certainly that everyone is going to get it. If your mother has it, you're not, guaranteed to have it. So, and there's so much anxiety surrounding hair loss that I guess I wouldn't want someone to say that they're destined to have it just because they have it in their family.
It's just, it's like a lot of other conditions that are genetic. You may have a predisposition, which means that you may have an increased risk, but it doesn't mean you let it control your life. Don't let it, worry you. But however, if you have another autoimmune condition, you can see, okay, there's some genetic basis to it. But it's not going to affect how you treat that individual, right? No,
and it could be a good thing that they're aware. So if they notice it, they'll get it treated earlier. But again, not to live with fear that when's the hair going to start coming out.
And the other key point that you made is that it's such an emotional or psychological damaging effect, when you have hair loss, because society values that, the appearance of it. I mean, there's nothing wrong with that, but I think all of us, fear in society that when you lose hair, and then if you give them another idea that maybe you're destined to lose hair, just a little bit more emotion and anxiety that goes along that's unneeded. So I think we can be aware of it as a knowledge base, but I don't think that it makes it any different. You don't do anything differently. You don't start using cortisone injections or shots. You just
Nothing
be aware
preventative.
Of it. Exactly. That was great pieces of advice. Thank you very much for taking the time with us and answering those questions. Please don't go away. When we come back, Partha's Prescriptions. Welcome back, and thanks for staying with us. Today we've discussed alopecia affecting the lives of millions of Americans. What can we take away on today's Partha's Prescriptions? Number one, There are lots of causes for hair loss. If alopecia is affecting your life, please consult with your dermatologist for solutions. Number 2, the emotional toll of alopecia can be significant. Join a support group to help cope with your difficulty. Number 3, be careful with hairstyles. Certain hairstyles, including braids, ponytails, and hair extensions, they can pull on your hair and cause hair loss. Number 4, remember that stress can cause temporary hair loss. For most of us, nothing more needs to be done. The hair will start to regrow without any help. For more information on alopecia, please visit our website at www.askdrnandi.com. Also, you can join the discussion on our Facebook and Twitter pages. Just search Ask Dr. Nandi. Now lastly, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. And that word is namaste. So namaste to each and every one of you. Thank you for watching and see you next time.